I really want to get started with this program because Jay Bloss is just wiggling around in that chair like he's waiting for something to get started as well. We go to the multiple cam screen that we've got here. I'm obviously in the mix somewhere. Pat Luces is over there, Department of Public Health and Social Services Diabetes Prevention and Control Program Coordinator and the Master Trainer for this chronic disease self-management program. There are no short titles anywhere, are there? I mean, it's just I can't do a sentence without losing my breath.
Whenever you get into health, we've got a lot of acronyms.
Lots and lots of that. And I'll introduce the ladies here in just a second. But Jay Bloss is here in the studio, and you're an actual what do you call it? Participant in this chronic disease self-management program. Tell me a little bit about that. Good morning, first of all.
Good morning.
How you doing there?
I'm good. I'm good.
What do you got?
A little bit nervous.
Oh, don't be nervous. No, it's just me. It's just a couple of guys. We could be talking sports. We could be talking girls with you, whatever. It's just, right. But in this case, we're talking about your participation. You are an actual patient.
I was a participant.
You was a part. Okay. Are you cured?
Cured. What is cured? We all have a little bit of something, right?
God, I love the philosophy. We're already getting into the deep stuff here.
Let's see.
I might look like I'm okay, but deep down inside my shoe, my sock is.
It's torn up here. So.
Lost your train of thought. It's all right.
Yeah.
It's all right. So you had a disease that for which you could have been going to a doctor all the time. You could have been seeing somebody all the time. But in this case, they said, Jay's big enough. He's man enough. He ought to be able to manage this disease on his own, correct?
Correct.
Okay.
It's not necessarily me that had the disease. Maybe a family member or someone that was close or that is close to me.
Well, good. Then this is a systems of care conversation as well.
Yes. Correct.
Okay, that's an important distinction. Tell me a little bit about the program from your perspective, and then I'll break into the rest of the conversation with the ladies and Pat here. So, how did it apply to you?
For me, it was with my grandmother. She had a stroke a few years ago, brought her health down quite tremendously, slowed her down, and it's taught me how to cope with that, like how to work around what she needs to do and how to use what I've learned with her to help maybe others in a similar situation or even myself in the future. So it's not just a today thing. It's a yesterday, it's tomorrow. It's all through our lives.
Yeah, I think I know what you mean. And there's it's from the perspective of a caregiver, you have to have access to the same, and I'll use phraseology from the actual program. You have to have access to and an understanding of the same tools that we would be asking anybody else in the program. And so I've got a listing of the tools, and we'll go over some of those. But were there one or two in particular that you found to be the most therapeutic in providing care to your grandmother?
I forgot what it's called. That little plan thing where we go through the weekly
the action plan.
There we go. Our action plans. Thank you, Millay. Where we go through and we try to set up small goals for ourselves to help better ourselves, or even the person that we're being a caregiver for to help go through our daily lives.
And that's great advice, whether you're dealing with somebody, whether you're dealing with a chronic disease yourself, whether you're providing care to somebody, but it's also great advice in life. Sometimes we're going to go through things. There's going to be episodes in our lives, and I've found that in my cases, sometimes it's important to be able to break things down into small pieces so that you can act on them. It's motivational to have a check mark next to something, and then as time goes by, you look at all these different milestones that you've passed, and what looked impossible, what looked insurmountable before, all of a sudden, I did that. I can do anything. And you start making bigger and better plans. So let me back into the program here and talk about with Patrick Luces again, the CD, I don't want to use the acronym, but I'm going to. CDSMP Master Trainer. How long have you been doing this?
Since September 2016, there's actually 3 master trainers here in Guam. Millay, Young, you'll hear her later on. She's with the GRMC, and then our other partner with the Department of Public Health and Social Services Community Health Clinic, Leanne Munya. So it was the 3 of us that actually got trained for this master training. So CDC actually brought this out to the Pacific for the first time. It's actually available throughout the world, but it's the first time it's available in this part of the world. And so when we did the training, we were together with CNMI, Marshall Islands, Palau, American Samoa, so the 6 U.S. APIs.
Yeah.
So we all became master trainers. So the three of us actually brought the Guam and started the training here. And we were very successful. Just last February, we trained 12 leader trainers. So they were actually branching out and doing their trainings as well.
So and so on and so on and so on, and then there will be a lot more people that are able to work with a lot more patients that have chronic diseases. And let's start with that. I mean, because the first part of your name here is chronic diseases. We're talking about Jay's grandmother who had a stroke, and that leads to other complications and perhaps changes in her lifestyle, his lifestyle, that need attending to on a daily basis. But I mean, this ain't hospice care, and it's not something for which you want to be in the hospital for a long time. And it's not something that you want to be going to a doctor every day to go take care of. So you need to put, as I said, the access to those tools in front of the patients, and then give them an understanding on how to use them.
That's correct.
Okay, so I think I've got a good grasp of this. One question for you, Miley, from Guam Regional Medical. I'm sorry?
Millay.
Millay, sorry. So Millay, sorry, I actually wrote it down too and didn't look. So why is GRMC particularly interested in this?
Our philosophy is we're patients are partners. And so when I first heard about the CDSMP program being offered to the community partners, so I didn't have any second thoughts in having our patient education department engage with public health. Because again, it's partnership with patients. And what is fundamental with the chronic disease self-management program is how it enhances the patient and the family's experience of care. So we're not prescriptive in what we teach, meaning we don't tell them what to do. Rather, we provide them information, and then we guide them in using these tools so that they apply it to themselves, they apply it to their family, and be able to lead a healthy life, enjoy their life with a chronic condition.
And enjoy it better, yeah, and be able to have some kind of quality of life, because as anybody knows, especially stroke patients and folks that are recovering from one thing or another, oftentimes there's a drastic reduction in that quality of life, and so this, as I was using my mom as an example, fibromyalgia, which is one of those chronic diseases, and I'm sure it's something that is covered here, where you don't know what today is going to be like. You don't know where you're going to hurt. You don't know what you're going to feel like. So it's important that you have tools to help you get over and above those, so that you can continue to spend time with your family, continue to go to work, and do all of those kinds of things that we do. Janice Baldonaldo from Department of Public Health and Social Services as well, correct?
No, sir, from GRMC as well. Patient Educator.
I'm sorry.
Yes.
I thought I had somebody else in here from the public side. But only you?
I'm the only one from
You're
the
the only one from the public side. So let me go back to a question that I wanted to ask first, because chronic diseases in the front of that. So how do we define chronic diseases?
Chronic disease is similar to what we know as non-communicable diseases. These are diseases that are chronic, such as heart disease, cancer, stroke, diabetes, arthritis. And we also have a lot of people now with gout. So these are the chronic diseases. They're not communicable. They're not communicable.
We put gout in there too?
As part,
I know
part
people
of
that are listening going, wait a second.
Yeah.
Well, even-
This audience, this radio station, I'm sure I got a lot of gout patients in here going, wait a second. It sounds like we've elevated this now, so I'm getting a little bit of additional attention.
So to add to the list of chronic conditions that Pat had mentioned, it also covers mental health conditions like depression, even patients with mild dementia. So the program's experience, especially in the States with the seniors, they were able to touch on some of the patients who have mental illness and with dementia.
It sounds like, how would the doctors describe it, broad spectrum? It's kind of, there's
Yes.
you take a look at things that people might find themselves in, and whether it's physical or mental now, there is an avenue. I also want to touch a little bit on what I mentioned, the systems of care. I originally thought, Jay, excuse me, I should have asked before I cracked my microphone. I'm just crazy that way. But I would assume that as a participant that you were a patient. That's not necessarily the case. But you were there working with a patient involved in the system of care. That is family, friends, social circle, all being a part of this, right?
Yes, that's correct. I was.
All right. So to me, that's kind of interesting because I've been a fan of that systems of care where everybody plays some kind of a role in helping the patient have a better quality of life through whatever it is that they're trying to get through. So I'm kind of delighted that we take it from there. And so describe, if you will, if it was me as an example, and I identified with one of these chronic diseases, where would I begin to learn about this self-managed care?
So we have 3 point of contacts. That's the 3 master trainers, myself. I'm over the public health side. So they can call me at 735-7295. We also have Millay, who's over at the Guam Regional Medical City, and she has her contact information as well. And Leanne, who is working with our Southern Community Health Clinic, she can be accessible as well through the Southern Clinic.
Right. So once I get the contact, what do I have to do as the patient? What would my caregivers have to do?
So what usually happens is once we get a pool of individuals, anywhere between 8 to 15 individuals, we schedule a class depending on the location. It could be at GRMC or it could be at the Northern or Southern Community Health Clinic.
GRMCs, you guys got great classroom facilities there.
Yes, we do.
I've lurked by there. I've gone from one place to another, and it's like, and almost every time I have, something's been going on. So remind me to talk about your educational facilities inside Guam Regional Medical City itself. So you'll have these little outreaches, right? Everybody gets together, little meetings and seminars.
Yeah. So now that we have more leaders who have been trained, we've kind of been doing
them more often.
We've been actually doing them every other month. A new class starts every other month. The last one we have one that just started, and it's at the Northern Dededo Senior Center.
Okay.
So we're flexible as long as we have the leaders that are available and we have a location. We can work with the mayors and actually even do it in any part of the island.
Right. So it's just getting together enough people, and as my understanding is, some of these diseases, especially when we start talking about diabetes.